Information from this video is not to dispense medical advice nor prescribe the use of information as a form of treatment for medical problems. Please always consult with your physician or medical team on questions you have.
Hi, my name is Judy Macias Harris. I'm a speech language pathologist and the inventor of a waterless, bristleless toothbrush called the Light Brush. I, again, wanted to invite one of my favorite people, Barbara Tritz. I read her blog endlessly monthly because I find her information valuable. But I wanted to pick her brain regarding a topic that's been on my heart. And so I just wanted to get some feedback from Barbara, hear about oral hygiene, oral care. And my question, Barbara, is oral care more an integrative approach? Not so systematic like our traditional that like what we think. Is it actually a little bit more integrative?
Well, Judy, you are so correct. Oral care and dental problems, dental tooth decay and gum disease are actually just a symptom of a bigger problem systemically.
Mm-hmm.
We have problems in the gut, we have problems with the food we eat, and so those problems show up as a symptom of a disease in the mouth.
Mm-hmm.
So we need to look deeper for what the root cause. And as a biological hygienist, that's my goal, is to find the root cause of the problem so that we can fix the root cause.
Mm-hmm.
Prehistoric man did not have tooth decay and gum disease until 12,000 years ago. And that's when he started farming. That's when he started eating more fruits, more carbohydrates and wheat. And then decay really took off in the 17 and 1800s when we started introducing sugar, because our body cannot digest sugar. So these foods that we're eating, these carbohydrates, they don't break down in our gut. And so they cause what we term leaky gut. And so now we have half-eaten particles, we have dead bacteria, we have food debris going off into our bloodstream and causing an autoimmune reaction. And tooth decay and gum disease are a symptom of that, just like other, autoimmune diseases. So unless we fix the root cause, we're going to continue to have tooth decay and gum disease. If we're not eating good food, if we're not getting the nutrients that we need, if we're not getting fat-soluble vitamins, we'll have tooth decay, we'll have gum disease. So fixing, cleaning your teeth, absolutely. I always start off with, let me show you how to brush your teeth, because most people don't brush properly. They don't know how to brush. You've got to brush your gums. You've got to angle the toothbrush. And even though the electric brush is going crazy and wiggling, you still have to jiggle the toothbrush into your gums. You still have to clean in between your teeth, because the toothbrush only cleans 60% of the tooth surface. So there's certainly a lot of important aspects of oral hygiene, just getting the plaque off, changing the microbiome. But then we need to look deeper. What's the cause? And so as a biological hygienist, that's where my focus is.
In your blog, Pioneering Preventions, you wrote that back in 2019. You also talked about the airway. And I find that very, very interesting, because I did a little experiment on myself and I posted it on my Facebook page. But what it was really trying to bring my gum health back up to 1. So back in 2019, April 2019, I was showing early signs of periodontal disease in certain areas of my mouth. And so the marker was like a 4, and then of course bleeding gums, blah, blah, blah. And so I just experimented for a year, just revamping my oral hygiene program. So I stopped using products with fluoride. I went to xylitol. I started flossing 2 to 3 times a day. I started using Recaldent, got a splint. And I was just really diligent on the cleaning part. And I was able to bring my scores up from a 4 to 3. So and I use my product, my Light Brush. I use a red beam for inflammation. And so I was able to bring the scores up to 3, and I was really excited about that. And I thought, well, maybe can I do better? And so then starting this past June, I worked on gut health and also breathing. So I kept the same routine, And I also switched my light brush to a different setting, which was a red-blue combo. So I stopped eating sugar, refined sugar, and I substituted it with monk fruit or something like that. Went more plant-based. And then I also really concentrated on sleeping. So getting my airway open. I bought a little inflatable pillow. And then I also worked on mouth tape. And I was really focusing on conscientious effort of tongue placement. And I did that for 6 months. And lo and behold, my scores went from 4s to 1s.
Good job.
I know. But I really wholeheartedly believe that it was not because of the oral regimen per se. I think it was the integrative approach of breathing digestion. Like there must have been some kind of relationship with improving breathing that affected digestion that could have helped reduce a lot of the bacteria that could have been growing specifically at night. So do you have any thoughts about that?
Oh, absolutely. You hit the nail on the head. You know, mouth breathing dries the mouth out. It affects the immune system. You're not sleeping deeply enough, so you're not healing. You're not digesting food properly. You get acid reflux when you don't sleep properly. So it's all connected. I mean, you know, this doesn't stop here. This is connected to the whole body. And you are correct. You know, mouth breathing is number one. You know, I want my patients to breathe through their nose. That's the only healthy breathing is nasal breathing, 24/7. You know, even when you're exercising, you know, you really need to work on nasal breathing. Sleep, you know, deep, restful sleep, getting in that stage 3 sleep, getting in REM sleep, dreaming, getting good 7 to 8 hours sleep. You can't heal without it. So you're right, it's all connected. And if we only focus on getting the plaque off, we're missing the boat as the dental profession.
I have to agree. You know, for whatever, so this, you know, I'm still my own guinea pig.
Yeah, an N of 1.
It's like, I can do better. I can take these 3s to 2s.
Yeah.
And, yeah. And so right now, I think what I want to do is I want to see if I can maintain the gum condition, just kind of following this. But do you have any words of advice on how to really address the inside of the gum line? And I don't know exactly what you would call this part of the mouth. The posterior part of the mouth, right?
Yep.
Because for me, that seems to be the problem with my gums, is not necessarily the anterior part, but the posterior part. So, you know, and I think that might be a part that may be neglected. And then at night with reflux, you know, if you analyze the pathway of reflux, it's coming through the throat this way first, then anterior second, right?
Yes.
Do you have any thoughts about how to help with that?
Sure. You know, number one, I always tell my patients a smaller brush head. And the lower inside, that's where most of the tartar builds up because you have salivary duct glands right there that are flooding that area with minerals. So number one, if I see tartar buildup, I suspect right away that my patient is low in vitamin K2.
Interesting.
Vitamin K2 works with vitamin D3. And K2 tells the calcium in the blood where to go. So if I see tartar buildup down here, then I immediately suspect that there is a shortage of vitamin K2.
Okay.
So that's number one, nutrition. Number two, if you get a buildup down there, what I tell patients is dry brush with a manual toothbrush and brush there first. Start there and just brush. Brush until your teeth feel and taste clean. Then move to another part. You know, most of my patients, I want them to brush for 4 minutes with an electric toothbrush, not just 2.
Right.
And, you know, starting on the lower inside with the brush being just a little bit stiffer, that gives you a little boost as well.
So I think maybe this time what I'll do is I'll just add a vitamin K supplement.
Yeah.
Right?
Yeah. D3 doesn't work without K2.
Had no idea.
So
had no idea.
I did a blog post titled The Untold Tales of Tartar the Tooth. That's where I talk about vitamin K2. I had to think about that.
Do you see how catchy that is? This is why I'm addicted. Well, thank you so much for your time. It was a pleasure speaking with you, and I hope in the future to still consult with you. There's so many questions that I have, and I'm just very, very excited to be platforming oral care, especially in today's day and age. I think somehow or another it's finally going to merge and become part of the medical concept or the medical model. I think I don't know how it cannot, as you know, the mouth is part of the body. It's not a separate piece of the body. And
Well,
in my profession, everything starts here. You know, for speech, language, cognition, digestion, it all starts here. So thank you so much for your time. I appreciate it.
oh, my pleasure. Thank you.
Thank you.
Vlogs like this one are part of my Let's Mention Prevention video series on oral health. Thank you for sharing some of your time with me today. Ever onward.